getting your head around this. Okay, so what we want to do is focus on the fact that we've got 3 types of functional movement. Most of our work will be done at level 1. So level 1 functional movement is basically where physio's at. We've also got level 2 and level 3, and they're more sport orientated. So level 1 is push, pull, okay? And when we say push, this is not push press. Push press is using your legs to drive your arms. Okay, that's a level 2 functional movement, not level 1. We've got twist, we've got squat. The bend I'm looking for is not side bending, it's hip hinging. So hinging from the hips, okay, like you're taking a bow, and we've got lunging and gait. Most of you getting this right, okay, but some of you gave me level 2 functional movement. So that's your level 1 functional movements. Level 2 functional movements, some of you were giving me jumping, hopping, throwing, or catching. Push press with a ball, okay, or jumping or hopping. These are not level 1 functional movements. These are level 2 functional movements, okay? So just give me a quick thumbs, and then level 3 is the complicated stuff. Level 3 is plyometrics, like triple jump, gymnastics movements like a burpee, clean and jerk, complicated movements. Can you just give me a thumbs up in the chat if you're now happy with those? Okay. Yeah. So it's all a bit clearer. Let me just have a look at some of these responses. Oh, hang on a sec. Let me just share the right file. Okay, so let's have a look at some of these responses. Yeah, most of you happy with those exercises now. So that's all good. And like I said, really good standard of programs coming through. Really quite pleased with that. So keep up the good work. So now, without further ado, what we're going to go into is the biomechanics session. Okay, so we've started recording already, and we shall begin. So we are going to be talking about biomechanics in physiotherapy, and the importance of biomechanics can't be underestimated. Myself and James do research, and we're probably both using biomechanics. I don't know whether you're using biomechanics in your research, James, for running. Yeah, I think you might be. I'm certainly using biomechanics in my research.
That's exactly my research. So my research is running biomechanics, essentially.
Fantastic. So while James is doing running biomechanics, I'm doing biomechanics about carrying load and gender differences between men carrying load and women carrying load, and is there any difference? And that's what my research is on. So we're both into a bit of biomechanics. We're both a bit geeky when it comes to things like this. Would you say, James? A bit of a biomechanics geek, or I know I am.
Fair point. Yeah.
And I mean geeky in a positive way, not in a negative way.
Okay. No, I think I am a geek anyway. I'll readily admit to being a geek.
Well, I think you remember physio is one of those only subjects where being a geek is actually cool, because the more knowledge you have about your subject, the more respected you are. And it's that simple. You know, you can never have enough knowledge. And James and I keep studying, don't we? We never stop. You try to. No, fair enough. Okay, right. So this is our centering slide. This is what physiotherapy is about. Now, why do we keep coming back to this slide? So what happens is you've been doing other stuff today in the week, and we're just going to focus on physiotherapy. What is physiotherapy about? How how does it fit into your life? So first of all, it's a healthcare profession. The NHS is being stressed, as we know at the moment. Lots of people after COVID are going to need rehab, and it's the physios that are going to be doing that. So our job is busy, and our job is important. Our job is about human anatomy and physiology, understanding how the body works. This is really why we want to be physios, and we're going to focus on movement and function. In particular in PET, because that's kind of, as a physio, that's what we do. We are physical therapists. It's all about maximizing wellness and getting patients to achieve their potential, whatever their potential is, and then minimizing the disease and injury. And it's solving real world problems. So you are not going into a career where you will not be applying the principles of the things we teach you. So it's quite exciting as physio students, because there is a career path, there is a profession for you, and our profession is important and highly sought after. So, just know that you're doing a good thing. So what do we want to achieve today? What are our learning outcomes? So we want you to have, James and I want you to have a basic understanding of biomechanics and the importance of that in exercise. We want to know the difference between an open chain exercise and a closed chain exercise in terms of the kinetic chain. And also we're going to identify as how biomechanics can be used to either progress or regress an exercise. And then we're also going to be covering things like the squat movement, the hip hinge movement, and the hip hinge movement can be divided into either like a deadlift or a good morning exercise. It just depends where you have the weight. Some of you might be uncomfortable with these kind of gym and fitness terms, but it's something you're going to have to get your head around. Physiotherapists are the strength and conditioning specialists of the NHS, and we treat people from cradle to grave. So, you're going to have to get your head around these movements. It's going to be easier than you think. Fatima, can you just turn your mic off there? You're coming through, and we can hear what you're saying. So the principles of exercise therapy, massively, massively important. And we remember those from the acronym Sport Billy. Okay, we've got adaptation, specificity, progression, regression. That's what biomechanics will cover today. Okay, overload. We've got the drive principle for overload. We've got the duration. We've got the rest. We've got the intensity. We've got the volume, and we've got the energy system. And that's the all-encompassing overload. Reversibility, use it or lose it. And then we've got time out, which is our rest and our sleep and our basically our recovery process. We've got behavioral change, individuality. Now, individuality with regard to biomechanics is interesting because some people have got long torsos and short legs. Some people have got long legs and short torsos. Some people have got long arms. Some people have got short arms. So we have to adjust the exercise according to what we call the anthropometrics of the individual. We've got to identify the lifestyle that they're leading, trying to integrate more activity. Law of diminishing returns means that better takes longer. Okay, the fitter you get, the harder it is to get slightly fitter. And then your responsibility, that's when you give the responsibility back to the patient. That is for the patient to do. You cannot do the exercises for the patient. They have to do it themselves. So there's a lot of persuasion around this. So this is why these principles are so important. They really are. So, just make sure that you've got these in your head. We go over them week after week so that they go in. I know it's boring, but repetition is the key to this exercise. And we know that REPS is the acronym for exercise, which stands for repeatability, okay, purpose. We've also got the fact that it's planned, and then we've got the structure. So that's what we're doing in terms of the principles of exercise therapy. Can you just give me a thumbs up in the chat if you're happy so far with the principles of exercise therapy? Fantastic. So the majority of you getting comfortable with these particular exercises, with these particular principles. So that's great. It's important that you understand these and go over these. They take a little while to sink in. So on to our subject today, which is biomechanics. So biomechanics is basically human movement, and that's going to be affected by things like pain, what type of injury they have. Maybe they're an amputee, maybe they've got a neurological problem, any sort of dysfunction. We're going to try and optimize their movement as part of their rehabilitation process. So in body mechanics, we divide into sort of static or resting postures, and then dynamic, which is moving postures. And then we've got kinetics, which is the causes of motion. So these are things like ground reaction force, gravity, all that sort of stuff. And then we've got the kinematics, which is about the description of the movement or the motion. And that will be things like measured in meters per second if we're talking about acceleration, or degrees of movement if we're talking about range of movement. Okay, so that's the biomechanics today. Now, it is a bit heavy today with regard to some of the technical stuff, but James tells me that you're doing really well and that you understand everything you're being told. Is that right, guys? Are you understanding everything so far? Quick thumbs up in the chat if you're understanding me so far. Haven't lost anyone yet? Yeah, Rebecca's fine. Good. So if we were to sum up biomechanics in a nutshell, it's using the laws of physics and kind of bioengineering to describe what's going on in the body, dividing the body into segments, and then the forces acting on these segments as part of exercise prescription or daily activities, basically movement. So what I want you to do is I want you to write this down. Okay, this is so important. So just like we've got principles of exercise therapy, we've also got principles of biomechanics, and we've got 8 principles of biomechanics. So if you've got pen and paper or your phone or your tablet, whatever, make sure you type it in because this is important. So the first principle of biomechanics is force motion. So how much force is being used? Okay, second principle is force time. How much time is the force being applied for? Then we've got inertia. Okay, so we're resisting effectively change, resisting its state of motion. Okay, particularly if it's static and we want to go from static to dynamic. Range of motion that you'll get lectured on, I think it's next session, so range of movement. This is either linear or angular in terms of range of movement, so angular in terms of a joint. And we've got balance and stability. We did balance last week. And COM stands for center of mass. And BOS is base of support. Okay, so center of mass. Okay, so my head, my body is my center of mass. And the base of support is my legs, my stance. Now, if I take a wide stance, I'm going to be more balanced because I've increased my base of support. If I stand on one leg, I've decreased my balance because I've decreased my base of support. And then we've got the coordination continuum, which is about motor timing and optimal timing of motor movement. Okay, this is actually one of the components of motor fitness, coordination. We've got segmental interaction. This is about local joint isolation, like a knee extension or a bicep curl. And then we've got the sum of all segments, where we talk about things like open and closed kinetic chain exercises. So hopefully you've written those down, okay, because they are that important, because we're going to need to discuss them now in the breakout rooms. Now, what we're going to do in the breakout rooms is we're going to use these principles and think about how these principles will apply to exercise. So make sure that you try and contribute in the breakout rooms as well. I know the breakout rooms are new to you, but it's a good way of you meeting other people and you forming sort of close bonds and close friendships in the absence of being actually in class. So we've got those 8 principles of biomechanics, and how are they going to relate to exercise prescription? Okay, that's what we're after. Okay, so they're the 8 principles. I'll put them up in a second, but you won't be able to see those because you'll be in the breakout rooms. So how do those 8 principles relate to exercise prescription? Okay, so we're going to be thinking about how that happens. I'm going to be putting you in the breakout rooms now. So I want you to think about how you're going to be going into that particular mindset of about how we do stuff. Okay, so exercise prescription is you saying, I want my patient to do this exercise. Okay, I want you to do a squat movement, a push, a pull. Okay, all of those 7 level 1 functional movements. How do the 8 principles relate to those? And then how would we progress exercise? So a squat could progress to a squat jump, which could progress to to a single leg hop, which could progress to an Olympic lifting movement. I don't know, but what we're doing is we're trying to relate the principles, these 8 principles of biomechanics, okay, to exercise. Center of mass, Hannah, center of mass. Okay, so you're going to go into your breakout rooms now, not for long, but I just want you discussing this and see how you get on. Okay, so we're in the breakout rooms now, guys. 8 principles of biomechanics. How does this relate to us giving patients exercise? Okay, James, are you there, mate?
Yeah, still here.
Fantastic. So if you take group 1 and move up from group 1, and I'll take group 10 and work downwards.
Yeah.
Happy with that?
So just with regards to, are they just discussing or the thinking of exercises that?
Yeah, they're thinking of exercises as well. What we want them to do is start relating things like range of movement, balance and stability, sum of all segments, coordination, and just start thinking about the kinetics and kinematics of what's going on. Basically, just forcing them to have a look at how they would apply these principles and whether they can get their head around it without actually coaching too much. See if they can work it out themselves as well. Once we've posed the problem, we then give them the solution afterwards.
Okay.
Okay.
So basically, just come up with an exercise. Let's say, for example, like you say, a squat, and within that one exercise, within that squat, they can talk about how they feel some of these 8 principles fit into that.
Exactly. So hopefully they'll be saying, well, actual fact, this is going to be a closed kinetic chain exercise. So we're talking about sum of all segments. If someone's got a knee injury, how is that local joint going to change what they do? If we're going to progress the exercise from a squat to a squat jump, we're now overcoming body weight. We're now creating force and torque. And just getting them to think about these principles. I don't think we're going to come up with some great solutions initially, but I just want them to have a think about how these could relate to exercise. Does that make sense?
Okay. Yeah.
Right. I'm going to jump in with group 10. We're not going to be long. Just a quick 5 minutes.
Okay.
Right. I'll see you back in the room in 5.
Okay.